Top 10 Unsolved Mysteries of the COVID-19 Pandemic. The COVID-19 pandemic is changing the world in unforeseen and extraordinary manners, working out in a good way past wild creatures recovering urban spaces and beginner music exhibitions on Instagram. At the hour of composing this, near 2 million individuals around the globe have tried positive for the infection with more than 125,000 passings. And the projections work out in a good way over what we'd call reasonable. The human expense likewise incorporates a large number the world over who'll endure in the imminent money-related downturn, which by some master gauges might be our most exceedingly terrible one since the Great Depression. The infection is additionally particular in that we basically don't have the foggiest idea how it functions. It's something or other where the genuine and dependable specialists reveal to you that they don't know without a doubt, as there are as yet immense holes between how we anticipate that the infection should carry on, and what we're seeing among the patients on the ground. Why are young, fit people dying, too? One of the most concerning pieces of the pandemic is the excessively high pace of fatalities among the older. This permits the infection to spread essentially undetected among more youthful, less defenseless pieces of the populace. You may feel that is something worth being thankful for, however it's definitely not. SARS-CoV-2 can lie undetected and spread far and wide, until it arrives at the more established has and unleashes devastation on them. In the event that the indications were more extreme and recognizable in their beginning times, the infection would have had a far harder time arriving at its more seasoned targets. That doesn't imply that the more youthful individuals are resistant, however, as a significant number of them have kicked the bucket from the infection, as well. It's something we don't yet totally grasp, as per our present comprehension of the pandemic. Generally fit and more youthful people ought not be building up the more genuine manifestations. It's a major piece of the bigger inquiry of how the infection influences various individuals from various perspectives, and noting it is significant to forestalling future, possibly deadlier flare-ups. Can we infect animals? In spite of the somewhat not insignificant rundown of things we despite everything don't think about the COVID-19 pandemic, we do realize that it originated from creatures. There's as yet wild discussion around precisely which creature it was, with pangolins, bats and even poultry as potential suspects. However, we're speculating specialists will get to the creatures once they're finished with the humans. What's puzzling researchers, however, is the manner by which the changed, human type of the infection is currently transmitting back to creatures, something nobody had anticipated. Among wild creatures, a tiger at Bronx Zoo was as of late determined to have the COVID-19 strain, alongside a few others beginning to show comparative manifestations. While it's not really the main instance of its sort, the entirety of different instances of human-to-creature transmission include family unit pets. This is the principal occurrence of the SARS-CoV-2 strain tainting wild creatures. And nobody is certain how. Our best supposition is that it originated from one of the tainted zoo laborers with no indications. On the off chance that that is the situation, it ought to have given to different creatures, as well. No other creature, not in any case the other large felines, have indicated any side effects yet, so it's conceivable that it just influences tigers for reasons unknown. We still don't understand its biology. The facts confirm that the COVID-19 flare-up has disproportionately influenced the main world, implying that a portion of the world's best human services specialists are presently working diligently attempting to see how it functions. Worryingly, however, that hasn't implied a lot, as the SARS-CoV-2 strain has demonstrated to be undeniably more hard to comprehend than we ever imagined. At the core of the issue lies the central issue about the key organic structure of the infection. While we do realize that it's molded like a spiky ball with the spikes intended to break into living tissue, precisely how that converts into the ridiculously high pace of its spread stays a riddle. The same number of other generally innocuous infections including different coronavirus strains have the ability to do that, as well. We essentially don't have the foggiest idea what it is about the SARS group of coronaviruses that makes them so dangerous to people. Or even, as we'll come to in a piece, how it figured out how to influence people by any means. Its evolution in humans is still poorly understood. The science of the infection may assist us with bettering comprehend its belongings. However, there's as yet the topic of precisely how the SARS-CoV-2 strain figured out how to contaminate people by any stretch of the imagination. While we're no aliens to coronaviruses tainting individuals, they've constantly required some an opportunity to change and figure out how to contaminate new has. The last SARS strain, additionally called SARS exemplary, required some an opportunity to change in the human body before bringing about any genuine harm. The present infection, notwithstanding, apparently realized how to taint and slaughter as it so happens, as it hasn't changed in any impressive route since the beginning of the pandemic. That doesn't imply that it isn't transforming, however none of the transformations have had the option to pick up strength over the first one. Put it along these lines, the present SARS-CoV-2 strain doesn't have to change itself to taint more as it's now ready to do that absent a lot of exertion. People are testing negative, and then positive. While we ponder countless cases appearing the world over consistently, specialists are confronted with another unexplained issue. Numerous patients that were recently seen as negative are currently trying positive, raising doubt about the very strategies and devices we're utilizing to recognize it. While the facts confirm that the infection can stay lethargic for quite a while before it shows any side effects, almost every nation is as of now considering before releasing speculated patients. Rules from the now disfavored and defunded WHO necessitate that every single recuperated patient should test negative for the infection twice, with an interim of in any event 24 hours between the tests. Concerningly, a portion of those recuperated patients are currently trying positive for the infection, and we have no clue why. According to certain specialists, the infection may be able to deactivate and reactivate itself inside a human host. However, it could likewise be patients getting recontaminated from different sources subsequent to being released, or something different completely. We simply don't have the foggiest idea. Those conceivable outcomes, however, go against the famous thought that the recouped patients would build up an invulnerability towards the infection as it works in most different sicknesses we are aware of, which would thusly fortify the aggregate resistance of the entire populace. Additionally, if the infection can simply reactivate itself spontaneously, what does recouped even mean? The carriers with no symptoms at all. On the off chance that you study the different pandemics ever, you'd understand that the mystery of the Chinese infection's prosperity isn't its high pace of spread or even fatalities. We've managed far deadlier maladies than this one before. It's no place near the Black Death or the Spanish flu in its demise tally or pace of contamination. It is, in any case, extraordinary in one way. Contaminated individuals could approach their lives with gentle or even no side effects by any stretch of the imagination, helping it reach considerably a greater number of individuals than any of those sicknesses ever could. It makes, as a result, a general public brimming with typhoid Marys, or maybe more fittingly for our time, coronavirus Karens. What researchers don't have the foggiest idea, however, is what number of these cases are out there. Now, obviously known contaminations or famous hotspots can't be exclusively answerable for the downpour of cases pouring in constantly. While there have been numerous cases wherein patients with gentle or no side effects were tried positive for the infection, those are just the ones we had the option to test. Individuals with a runny nose or hack tend to not consider it a serious deal, and as per numerous specialists and researchers, they might be the essential explanation for the amazingly quick spread of the infection. Why are children so good at fighting it? It's no breaking news that the novel coronavirus strain influences everybody in an unexpected way. The quantity of fatalities are root higher for the moderately more established individuals, which is famously clarified by their debilitated insusceptibility. That seems like a natural clarification, however not on the off chance that you consider that the infection is basically inadequate on youngsters. Contrasted with grown-up fatalities, the quantity of fatalities among kids have been, fortunately, nearly negligible. While it's very incredible news, it's likewise mystifying. as children nowadays are not really known for their high resistance to infections, or wellness. Indeed, youngsters are for the most part at a lopsidedly higher danger of contracting respiratory viral diseases, similar to the normal influenza. But then, a lot more individuals expected to have better instruments to ward off the infection have passed on from it than children, and we truly have no clue why. How do patients recover? Now, we have a genuinely smart thought about how the novel coronavirus executes its casualties. Regardless of whether huge numbers of the conditions paving the way to that point are still covered in puzzle. What we despite everything don't totally see, however, is the means by which anybody recuperates from it. Usually for different sicknesses, patients recoup by creating antibodies, which don't simply assist them with warding off the present ailment, yet additionally secure their body against future assaults by a similar strain. That invulnerability may not be lasting, as on account of the influenza infection, however the body despite everything holds a few indications of having fended off the disease. That's not the situation for a shockingly high number of recuperated COVID-19 patients, and analysts are attempting to get why. In one examination done in China, a large portion of the recouped had created antibodies explicitly implied for the SARS-CoV-2 strain, which is the manner by which we'd expect it would work. 30% of the patients, be that as it may, had no indications of those or some other related antibodies, and it's hazy how their bodies recouped by any means. The invisible line of transmission. Regardless of whether the quantity of cases the world over is developing at a disturbing rate, we can in any event follow the vast majority of them to potential wellsprings of the infection. Realizing that a medical clinic is a hotspot can assist us with isolating and disengage the zone, contact everybody who may have been in its region during the pandemic, and guarantee that it doesn't contribute towards any more infections. Worryingly, however, we're likewise observing many perplexing cases from around the globe with no recognizable course of disease. For one, a little child in Gujarat, India got tainted and kicked the bucket regardless of there being no known cases in that whole region. Furthermore, one man in California turned into the main American to get the infection without coming into contact with any potential host. How does it spread? Most nations around the globe are giving a valiant effort to stem the pace of disease, including severe estimates like lawfully implemented lockdowns and social separating rules. The entirety of that, in any case, depends on the suspicion that all that we think about the infection is right. As increasingly more research is demonstrating us, we know practically nothing, and our avoidance procedures should reliably advance in the event that we get any opportunity of battling this. The greatest riddle of the COVID-19 pandemic is that we essentially have no clue how it spreads, and any individual who says they do is simply hazarding a speculation. While it was before accepted that it could just spread by means of physical touch, new research recommends that the infection could stay above water noticeable all around for any longer than we recently suspected, and doesn't require transporters like hack beads to spread. In a perhaps related case, a whole ensemble was contaminated with the infection in spite of staying away from one another consistently. Once more, it's our best conjecture that they got it from the air, as we're as yet not satisfactory on all the manners in which it could spread. Thanks for watching, subscribe to our channel, like it, bye.